This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Dean Leisgang. Today we are at the Aurora Health Center on Doctors Court in Oshkosh talking about pneumonia. According to the CDC, as many as 400,000 hospitalizations happen each year because of pneumonia. So this is the perfect time to talk about this subject with pharmacist Tony Buerger. Tony, thank you so much for making time for us today.
Absolutely. Thanks for having me.
We're talking about pneumonia again. Just let's start on broad strokes. What is pneumonia?
Simply put, it's a lung infection caused by Streptococcus pneumoniae. There's various types of it. It can be mild or severe for patients, and it affects people of different age groups, but pretty much anybody can get it. It's usually given to people by direct person-to-person contact through respiratory droplets. Usually presents itself rather quickly, an abrupt onset of fever and chills, cough, difficulty breathing, that sort of thing.
So you said, anybody could actually get it, but who is most likely to get pneumonia?
People over 65 and children under 5. But anywhere in between, there are certain risk factors that put you at risk for it. COPD, asthma, smoking, diabetes, cardiovascular disease.
And how do you prevent getting pneumonia? Is there a magic answer to that one?
Well, while we're here today, the pneumonia vaccine, of course. And then just proper hand hygiene, washing them regularly. If you sneeze, try to sneeze into a tissue, your elbow, your sleeve. Managing your chronic conditions, like if you have COPD, asthma, make sure those are managed well. And then if you're a smoker, try to quit smoking, or if you're not, try to limit yourself to cigarette smoke.
General good health tips
right
to go by, right?
Right.
Okay, so you mentioned the vaccine. Tell us more about the vaccination.
So there's currently 2 vaccines offered in the United States. There's the Prevnar 13 and the Pneumovax 23. When you're a baby, you probably got the Prevnar 13, you just don't know it. Yep. And it used to be that after the age of 65, you'd also get that one. The CDC's kind of changed their recommendations actually fairly recently. So I would suggest talking with your provider or your pharmacist about getting that additional one after 65. But everyone over the age of 65 pretty much should get the Pneumovax 23. It's usually something you get over the age of 65, and then also if you're under the age of 65, you might be a potential risk if you have the COPD, asthma, those kind of things that we talked about. You might be eligible to get a dose then, and then again at 65.
And then any side effects with the vaccination?
Typical side effects with most vaccinations, redness, irritation, pain at the site of injection, might get a headache, might feel some weakness, some tired type feeling, but overall I think it's generally well tolerated.
So someone decides they do in fact want to get that vaccination. What's their next step?
So talk with your Aurora Pharmacy. You can come right in. We give the vaccine right in the pharmacy. If you're over the age of 65, your Medicare Part B will cover it at no cost to you. If you have any supplemental plans or commercial insurance, we can run that ahead of time and let you know the copay before we even give it to you.
Hey, great information today. Any final thoughts that you'd like to touch on?
No, come on in. If you have questions about the vaccine anytime, just call us, stop in, and we can discuss it thoroughly with you.
Tony, great information. Again, appreciate your time.
Thank you.
Now, if you still have some questions or would like more information on pneumonia, feel free to reach out to the Aurora Pharmacy at 920-303-8700. Thank you so much for joining us today. I'm Dean Leisgang. We'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.